Hey everybody, Dr. Diane Mueller here. In this video, we're going to talk about essential info for Lyme disease treatments. Now, one of the things that is super critical that you know is that acute Lyme and chronic Lyme are going to be treated differently. So if you know 100% sure that you are in the acute stage, that you just got bitten, that you just wound up getting symptoms, that's going to be a very different treatment than chronic. With chronic Lyme, people have had Lyme for sometimes decades, sometimes years, sometimes months, but many people, years or decades. In that sort of situation, we have widespread imbalances that are caused by the Lyme disease. So basically, we can see that the metabolism is dysfunctional. We can see the thyroid's affected. We can see the adrenals are affected, the sleep. We can see that multiple organs are not working. We can see that some nerves have died. We can see the detoxification system is out of balance, the digestive system, and that people are just inflamed all over. So there's a lot of different ways from a treatment perspective to really work with chronic Lyme. I do recommend that you find somebody that is philosophically aligned with you and the way you are aligned from a treatment perspective. Now, one of the things to make people aware of is a lot of people are using doxycycline as a first line of treatment in acute Lyme. And I'm not saying there's not reason to do that, but we want to do it carefully, because one of the things we see with doxycycline research is that doxy can make the Lyme, the major form of Lyme, actually die. So Lyme is caused by a bacteria called Borrelia. Borrelia has the ability to shift, to morph, to change into different shapes. And the ability of it to change into different shapes is actually connected to its ability to evade our immune system. So one of the things we see in a chronic picture or even an acute picture, if somebody does something like doxy, they oftentimes feel better. But what can happen is it can actually create a situation where their acute Lyme is cleared, but we actually see that the Lyme, the Borrelia, goes into this dormant form and can reactivate years later. So you want to work with a Lyme literate clinician that knows things like this. And your goal is really to treat the acute, but also to use things such as other antibiotics or other herbal medication to prevent Lyme from going into some of these dormant forms to only come out years later. So we see that Lyme disease is connected to chronic fatigue syndrome, fibromyalgia, crazy neurological problems, dementia, so many scary things. So it's really, really, really important, even if doxy is the method of care that you're using, there's lots of reasons to consider that in the acute stage, that you're not doing it as a standalone treatment, because what you're wanting to do is you want to prevent Lyme from going into one of these other forms and showing up later on in your life. And so when you combine some of these standards of care with some other medications and other herbal remedies, you can actually prevent this from happening. So this is why no matter what stage you're at, it's definitely good to, really important to work with somebody that is really well versed in the treatment of Lyme. And if you are in the chronic stage, it's important to not just kill and not just detox, but to actually heal the body, to build up the system again, to reset the hormonal cycle, to build up the nutrition that may have gotten destroyed during the process, to make sure that you are doing everything you can to really bring yourself back to health and wholeness. So if you like this information, please do subscribe to the channel. There's a lot more information on there. You can learn, if you're watching this on YouTube, you can learn more about my clinic in the show notes, and I'll see you next time.